Shanahan. Minister, I want to divert slightly just in terms of the debate and just ask a question. And that is, how does independent politics work for citizens in this House? And in terms of this, the provisions that you put forward in this bill, I think it'll become eminently clear the value of that. The social welfare assessment schemes is to take into account any and all revenues in terms of considering applications for social welfare, working family payments and supplementary allowances. As such, households who were in receipt of social welfare supports last year could not play any active part in terms of trying to offer accommodation to anybody within our housing crisis. Our regional group, my colleagues here and others within our regional group of independents, presented to government last year a range of policy initiatives as part of our stance to help support and deliver progressive politics. As part of our 8-point policy initiatives, which I am happy to say now have nearly all been entirely activated by government, we called for an initiative to allow expansion of the rent-a-room relief scheme to include social welfare recipients, enabling them to lease a spare room in their residence so as to increase the national stock of badly needed accommodation space. Government's agreement to such implementation of this relief 1 month later after its proposal has meant that for a period of 2 years since, following the policy amendment, individuals who choose to rent a room in their house could claim up to €14,000 per annum in disregarded income for the purposes of social welfare means assessment. For households with retired owners-occupiers, this initiative means that families could avail of an additional weekly rental income of €269 per week without any effect to their non-contributory state pension. It also means the benefits applying to a spouse or adult dependent of a contributory pensioner were not affected. However, rental income was being considered in a means test for those on means-tested welfare payments, which effectively ruled them out of the scheme. And as such, again, our group called for a re-evaluation of the scheme to take account of those in receipt of supplementary benefits and medical card supports. Minister, I and my colleagues today are heartened to see part of the bill proposing the extension of the rent-a-room relief scheme to people receiving social welfare payments, renting out a room so as they do not lose supplementary benefits and medical card supports. I think government recognising the regional group initiatives is a clear sign of the value of independent voices within this chamber representing the population at large. A second provision of the bill, Minister, I see is to provide for an amendment to current legislation to more management and access by you as Minister to medicinal products. And I haven't read the bill in detail, Minister, but I am hoping that this is going to allow you to look widely and favourably at a significant number of applications which come in to the Irish HSE, to the HPRA, to the Medicines Review Group every year, particularly in the area of orphan disease, Minister. And I think, as you know, there have been a number of drug products that have come on the scheme. I think maybe upwards of 150 in the last few years. There's probably another 150 that are out there for specific groups of patients, Minister. And this is always going to create a very difficult economic question. You know, if you have one patient who's potentially their treatment might cost $500,000 in a year, as opposed to maybe you can service 10 patients for $50,000 a year. And we understand the conundrum, but there are some patient groups, Minister, and they are very small in number. And I met with a gentleman earlier today who is trying to figure out how they can access orphan drug schemes and they have only 5 patients which they're treating presently in Ireland. But they cannot see a pathway, Minister. I understand that recent meetings that you have had, I think I heard the Taoiseach reference in the House here 2 weeks ago that €20 million had been ring-fenced for the provision of orphan disease medication, assuming that they get reimbursed approval. But I understand that money is now no longer on the table, and seemingly it is going to be, if at all found, it will be found through health savings delivered anywhere else. And I think you and I, Minister, both know it is very hard to create health savings in the present system. So I would ask, Minister, that you would have a significant look at the orphan disease space. It's a very small number of patients. I understand that there are developments in this area. I'd be happy to try and give support to it. And I do know of a number of companies, and I think you probably do also, who are trying to see about access to that programme. As I say, we have small numbers of patients around the country, but some of them are suffering terribly, and one in particular relates to very young children in their growth phase, and if they do not get interdicted, they do not grow, with all the obvious problems of dwarfism and all of that. So that's just one other aspect, Minister, but I commend you, Minister, for taking on certainly the initiatives that we proposed last year, and hopefully for the one that I suggest you now.